Hi guys, my name is Amanda. I'm going to be showing you how to do a vaginal examination. I have a Chuck's pad down, a pretend one, for my client. I have a covering for them, and we have already discussed why we're having a vaginal examination, and they have consented to it. And I've washed my hands, and I have gloved up. So let's start. So the first thing you're going to do is you're going to lift up the towel or blanket so you can see the vulva, and you're going to visually see if there are any blisters or cysts or anything else like that abnormal. And then you will take your lubrication and put it on these two fingers. I would like to say if you are in active labor and the water has already broken, then you should definitely use sterile gloves and sterile lube. But we're just going to do this for practice. And you don't really need sterile gloves if you're doing a vaginal examination before the water has ruptured. So what you will do is you'll say, so you're going to feel, to the client, you're going to feel my touch on your right leg, and you're just going to kind of use the back of your fingers to touch their leg. And then with your left hand, you're going to say, okay, I'm going to now separate your labia. You'll separate the labia, and then you will slowly introduce one and then two fingers this way, hand down. And then you don't need to hold the labia anymore because you're already in the vagina. And then you will slowly go forward until you reach your first knuckle. At your first knuckle, you're going to let your client know you're going to feel me rotate my hand so I can start feeling for your baby. So you'll rotate your hand like this. You want to make sure to put your thumb out like this and put it in their groin area so you don't accidentally hit the clitoris with your thumb because that's uncomfortable. You're going to continue going forward and you're going to try and find the cervix. If your client has very posterior cervix, you might need to ask them to make fists and put them under their bottom so that their hips are tilted forward and you can find it. You may also need to walk it forward if it's super posterior, using your middle finger and kind of hooking it and pulling it slowly towards the front of their pelvis. Once you have found the cervix, you want to try and find the entrance and get your fingers inside. We'll say this client has an open cervix and I'm able to get both fingers in. And once you're in, you're going to evaluate their dilation by spreading your fingers. So I can spread my fingers this far on this client, and for me that would be about 3 to 3.5 centimeters dilated. You're also going to want to notice how far up your finger the cervix goes, and that's the effacement. So we'll say this person is 75% effaced because it's still fairly long, and it's covering most of my fingers. The next thing you'll do is you'll try and find the bag of waters. So you'll have to push forward more to find the baby head and bag of waters. Sometimes it can be really slick against their head and difficult to find. In that case, sometimes it's helpful to push on the fundus and push baby kind of down so you can feel baby head and bag of waters a little easier. If it's bulging, it's going to feel like a cheek full of air. And if it's not, it's going to feel really slick on the baby's head. Once you have found the bag of waters, then you want to see if you can find baby head. Sometimes you have to push a little harder to find the baby head. You want to be careful to not break the bag of waters. And then you're going to see if you can feel for sutures. That can be difficult if they're really high up like the baby is right now, because I would say this baby is at like -2 station, and it's kind of really hard to feel this baby. So maybe you can't feel the sutures, and that's okay. So then you're going to come out slowly. You're going to let your client know, and then you're going to cover them back up, and you're going to let them know that there was a little bit of bloody show due to your examination, and that is normal and okay. And that is basically how you do a vaginal examination. I hope that was helpful for you guys, and thanks for watching.